Okay, so today we're talking about Plan B, right? Also known as levonorgestrel or Levonel in Britain. So it's only for emergencies. Don't take it constantly. It's not a constant drug, right? Because it can mess up your cycles, your menstrual cycle. So it won't be regular, but you can take it more than once in one menstrual cycle. But there are going to be effects. So it usually is taken when you have unprotected sex and you don't want to get pregnant, or maybe you're using a condom and it broke, or some other method and it didn't work. So you should take it within 3 days of having sex, and the closer it is to the period you had sex, the better the drug works. You can go up to 4 days, but then the effectiveness is really bad. Very important, very important. These drugs do not work after ovulation. Ovulation is when your body releases the egg. So if you take these drugs but your body has already released the egg, that drug is not going to work. So probably you're going to be pregnant. So if you suspect that you probably did this thing after day 14 when the egg is released, you have to what? You probably have to do intrauterine device contraception. So that's when they put this small little device inside your womb, and it stops pregnancy from happening. So the dose might be different if you're on some drugs like epileptic drugs, right? If you're on some antiretrovirals for HIV, or also if you're on certain antibiotics, things might be different for you, and your doctor will explain it. So the main reason people might not take it is if you have an allergy to something within the drug. So about the effects of the drug, right? If you vomit within 3 hours of taking the drug, you have to take it again because it wouldn't have been absorbed enough to have an effect. So yeah, if you vomit, take it again. And also your period, right? It might come earlier than usual, or it might come later than usual. But on the later part, right? If your period comes 5 to 7 days more than the usual period, or you have lighter bleeding than you normally have, you should have a pregnancy test, right? And in any case, you should have a pregnancy test after 21 days, just to be sure before you go back to your normal contraceptives. And also, if you have severe pain, right, some days after taking it, if you have severe abdominal pain, like severe pain in your belly, it might be a sign that you got pregnant, but the pregnant is not right. It's called ectopic. It's when the egg goes somewhere which is not the right place, and it would have to be treated. So you have to go to the doctor because it's really an emergency. With people who breastfeed, the drug might go in the milk. So usually it's recommended that they take after breastfeeding, and that they avoid breastfeeding for about 8 hours after they take the drug, because a little bit of that drug of Plan B can get into the baby's milk. And lastly, you might have some side effects like a headache, might feel tired, a little bit of dizziness, your breasts might feel tender, a little bit painful. But those symptoms are supposed to pass after a few days. Catch you tomorrow, and tomorrow I'll be talking about injecting insulin, right? You're not supposed to repeat the same site for over 2 weeks because it can lead to some things. So yeah, I'll be talking about diabetes tomorrow. So catch you later. Dok Bolozi.